Welcome back to Hannity Show. As speculation swirls about Hillary Clinton's health, today the Drudge Report had a headline saying, quote, 59% say release medical records. What's wrong with her? So why won't the mainstream media talk about this story? And will the Clinton campaign release Hillary's full medical records? Joining us now from the Fox News Medical A-Team, medical correspondents Dr. Mark Siegel and Dr. David Samadi, and former 2016 GOP presidential candidate Dr. Ben Carson. Dr. Carson, I'll show you the different examples. She's falling. You've got this sort of twitching thing that she does in front of reporters that was really bad. There's been a number of incidents and reports that she fell, and then she had this really long incident where she was out of commission for quite a while, recovering, her husband said. She's on anticoagulants. Number one, do we have a right to know? And number two, what do you make of this twitching thing that she keeps doing? I'll run it again.
Well, you know.
Why are you laughing? You're the brain surgeon here. I'm just a humble little host.
It just looks funny. You know, certainly as a person gets older, you know, the number of medical conditions that we have to watch for increases, which is one of the reasons that we strongly suggest as you get older that you have at least an annual examination. If you're going into a very important position like this, it's critical. Right. And that information should be something that we should have access to because it's very important in terms of making that decision. Also recognize that the presidency is not a 9-to-5 job. You know, it is extraordinarily grueling, and you need to have everything going for you. And also the mental capacity. You know, there are standardized mental examinations, many mental exams, about 30 questions. You can get a very quick assessment in terms of what's going on. These are the kinds of things that should be open to the public in making such a critical decision.
All right, let me go back to this video, Dr. Siegel, that's on the screen now. We'll put it up again. I mean, it's a violent, repetitive jerking of the head here. Now, you know, you can see it's uncontrollable. Watch the reporter, like, pull back as the reporter got scared, and she keeps doing it. What is that?
Well, it's an involuntary movement. I first want to say we just heard from one of the top neurosurgeons in the history of the United States, not just a political person. Number two, Secretary Clinton hit her head in 2012. And
would it cause this?
Well, it would cause the kind of brain damage possibly, we've been studying this over the last 2 years, that can have long-term effects, that can have effects on thinking, on memory, on gait, on how you walk, on dizziness, on balance. That's a possibility that we need to see the records of. We need to see the records of anyone that's around the age of 70.
What about the so-called, you know, how do you say this?
The blood clot.
Well, you got the blood clot. You've got her.
She's on lifetime Coumadin. She had a blood clot. She has a family history of stroke.
Right.
That blood clot, as Dr. Carson will tell you, can sometimes be accompanied by a stroke. Not in this case, because an MRI afterwards was negative. But these are the kind of reasons.
Do we know that for sure?
Well, we certainly.
We don't know that for sure, do we?
We certainly learned that from what records we got, but I'd like to see the full record.
Yeah, Dr. Samadi.
Well, I think like everything, it pretty much started based on all the facts that we know. In 2012, she had the concussion. 30% of the patient can have symptoms of mini seizures. They can have vertigo. They can have forgetfulness.
Is that video we're showing a seizure?
Well,
maybe.
It certainly could be.
Watch it right here. Let's just watch. I want to watch it closely here. Watch the reporter back right there. You see the look, and it goes on and on and on. That is, to me, bizarre.
There's certainly some neurologic issue going on depending on when this tape was taken, but 30% of the patients that have some sort of the post-traumatic injuries, they can have cognitive issues, forgetfulness, sometimes they can forget words, etc. But what she has also, let's talk about this blood clot, because that blood clot and the MRI that they got, it saved her life. They got an MRI, they saw this blood clot near the sinus transverse behind her right ear, and that's where probably sinus, and that's probably one of the reasons why I think she's probably has some vertigo, and that's one of the reasons why she has all these falls.
That's why the falling takes place.
Exactly.
Sure.
She also
I think in terms of not speculating, I want to be very clear on something. I'm more concerned about the video that shows her inability to catch expressions and words and changing the topic she was on. The video
you mean when she sort of has these brain freezes?
Right, brain freezes.
Let me show one of the brain freezes so I can.
Just to be clear on, I talked to a top epileptologist epileptologist today, a seizure specialist, one of the top in the country, that does not think that's a seizure. So I want to be clear. We need the records to be able to make those determinations. But the one where she was searching for words.
Well, let's play that.
We do not need another big contentious debate about health care. We need to make what we've got work really well and improve it and get the costs out of an upward spiral. Now, I want to mention two other things.
There was a little bit of a brain freeze there, but I may actually be more sympathetic to that as somebody who's been a public speaker.
And that could be all it is. That could be all it is, but we need more investigation.
Dr. Carson, let me give you the last word because we got to roll.
Yeah, there's a lot that can be determined, you know, by medical experts if we have access to the records. And for such an important job, such a position, there's no way we should even consider doing it without having a look at those records, particularly for people who are elderly.
I don't think we're getting the Wall Street speeches or the speeches, copies of the speeches that she gave to big investors and insurance companies. And I don't think we're getting this either. I think she's going to keep it undercover, which is probably by design.
I think Dr. Carson is right. I think the record that we have is the last one was July 2015. It's a year and so after, and that picture that you showed going up the stairs, people helping, that was
you think it's a vertigo caused by the brain?
You know, it was an honor to look at Senator McCain's records.
You're right. That's a good point.
It will be an honor to look at her records. It's her life. I want to see it, and Donald Trump's as well.
All right.